There's no doubt we are in the electronic age. More than 60% of homes in the U.S. have at least one computer, and that number is on the rise. But the rate of injuries connected to computers is increasing even faster, especially among children. Computers connect us to the world, but they're also becoming a growing hazard in homes. Computer ownership has increased by 300% over the last 13 years, but a study during that same time period found computer-related injuries rose by a whopping 700%.
There's an increased number of accidents related to computers, probably from kids having more access to computers and then becoming more commonplace in the homes. Children are more apt to trip over the cords and injure themselves or pull the monitors down on themselves, causing head injuries and injuries to their limbs as well.
Researchers at Ohio State University reviewed more than 78,000 computer-related injuries treated in U.S. emergency rooms. More than 90% of the injuries occurred at home. The most common causes were tripping and falling over computer equipment, but 1 in 5 injuries were the result of falling monitors or computers. To minimize your risk, carefully look over the setup of a home computer.
And then computer monitors should be pushed back on the table as close to the wall as possible, so it's less likely for children to be able to pull them down on top of themselves.
And keep all those cords and cables organized, bundled, and if possible, out of sight.
I definitely would recommend that parents minimize the amount of cord slack that is around. If the cords are pulled tightly, the children are a lot less likely to trip over them. Also, making sure that the cords are between a desk and the wall can make this a lot less likely to happen.
Researchers did find the number of monitor-related injuries has dropped, likely due to the growing trend of smaller, slimmer LCD monitors. Well, if you go online, there's all kinds of advice on ways expectant parents can guess the gender of their baby. Everything from the food you crave to the way a necklace swings. But now an at-home kit claims to be up to 80% accurate in predicting the sex of a baby. Intelligender, the creator of the boy or girl gender prediction test, says researchers have found chemicals and certain hormones react differently if a woman is carrying a boy or a girl. The company claims that as early as 10 weeks into pregnancy and within 10 minutes of taking a urine test, a woman will be able to tell if she's thinking pink or blue. Parents typically don't find out the gender of a baby until around a 20-week ultrasound. Now to some groundbreaking health news. Literally, Central Baptist Hospital is expanding by adding a second facility in Brannon Crossing. The new building will house Baptist urgent care, expanded mammography services, and physicians' offices in a multi-specialty clinic. Construction of the project is expected to be completed in the fall. Live in the studio tonight, Kristi Runyon, ABC 36 News.